I am no longer consumed on a minute-by-minute basis with the panic, anxiety, and depression I dealt with from 1998 through 2000. Then in March of 2002, my daughter, at age 32, suddenly began having panic attacks 3 months after the birth of her 4th child.
You know, I started definitely knowing what my mom had been going through, at least talking with her.
Janet said she didn't feel well. I look over and she's bent over in the car, clutching her chest, head down, and very still.
After checking me out to see if I was having a heart attack, the doctor on call at the hospital instructed the nurses to strap a heart monitor to the middle of my body. I gave the psychiatrist a rundown of my physical symptoms, which, he assured me, were all attributable to my unstable mind. At approximately 2 o'clock in the morning, I awoke with my heart pounding out of my chest. I felt totally nauseated and could barely get out of bed, stand, sit, or walk. The family doctor also suggested I make an appointment with a gynecologist. The antibiotic did stop the urinary infection, but the hormone replacement therapy did nothing to help with the insomnia. I called the psychiatrist to let him know it was not working. He was very abrupt with me and said he'd already spent more time than normally allotted, and if I chose not to follow his protocol, I was on my own. In mid-December, I made an appointment with a neurologist. His great solution was a prescription for a hypnotic sleep medication used for insomnia. Despite all these efforts to get well, by Christmas of that year, I was barely functional. A few days after Christmas, my mother came over to our house. I could tell she was really worried about what was happening to me. Shag Rothwell is a nutritional therapist who was the first to confirm what I already knew, but could not get anyone in the medical profession as yet to agree with, that my symptoms were not all based on mental disturbances.
When Janet came to my office, she presented essentially on the phone, I believe they said it was panic disorder.
Well, first thing we do is a procedure that goes on at most clinics, except we take a little more time with it, and that is we ask questions and we listen.
Rather than giving me any kind of instant diagnosis, I was scheduled to begin a series of diagnostic tests.
I first met Janet after she'd met with Dr. Wright and had a series of tests. Some of these tests included things that would show food sensitivities or allergy, also things that showed her candida.
Another condition I probably had is called the leaky gut syndrome. Actual holes in the mucous membrane of intestinal walls can form from toxins which allow abnormally large molecules into the bloodstream. That can start an allergic or inflammatory reaction. In March, I began meeting with a counselor, Victoria Heemstra, who practices transactional analysis therapy.
Transactional analysis, rather than Freud's id, super, id, ego, we believe in this model that every adult has 3 ego states.
Janet came into my practice and presented as a very compromised individual. Her health was declined and she was extremely fatigued.
Janet came to me referred from a couple different sources. One, a holistic physician in this area, Dr. Jonathan Wright, another health practitioner, Carone Scott, both she had been working with.
One of the primary reasons for relating my story is to give those of you watching encouragement to find a path that is right for you. Trust your own inner voice, not just the advice of others. Stay with it. Keep searching for answers. Believe you can be well. And look for those partners in wellness who can help guide you through your own healing journey. This documentary is a tribute to each of the sensitive, informed, dedicated, holistic healthcare professionals under whose guidance and care I became well.